and today I will discuss the pathophysiology and also the signs and symptoms associated with systemic lupus erythematosus. Port 2015 describes SLE as a chronic inflammatory disease that can affect virtually any organ system, including the musculoskeletal system. SLE is characterized by the formation of autoantibodies and immune complexes. SLE is also an immune disease, which means it's caused by a breakdown in the ability of the immune system to differentiate between self and non-self antigens. A healthy immune system uses a process called self-tolerance to differentiate between foreign antigens and self-antigens. The cause of SLE is largely unknown. Persons with SLE appear to have defective elimination of self-reactive B cells with a resultant increase in the production of antibodies that can cause tissue damage. The development of antibodies can be result of a combination of genetic, hormonal, environmental factors. Genetic predisposition is evident by the occurrence of familial cases of SLE, especially among identical twins, and the increased incidence among African Americans compared to whites. Studies also suggest that an imbalance in sex hormone levels may play a role in the development of the disease. Evidence suggests that estrogen stimulates the immune response and androgen suppresses it. Viral and bacterial infections may also contribute to the development and exacerbation of autoimmunity. In many people, the onset of autoimmunity is associated with or preceded by infection. Signs and symptoms or manifestations. SLE can manifest in a variety of ways. The disease has been called the great imitator because it has the capacity to affect many different body systems, including the musculoskeletal system, skin, cardiovascular system, the lungs, kidneys, central nervous system, red blood cells, and platelets. The onset may be acute or insidious, and the course of the disease is characterized by exacerbations and remissions. Arthralgia and arthritis are the most common manifestations of SLE and are present in up to 90% of persons at some point during the course of the disease. Although the arthritis can affect many joints, it is most often symmetric with the involvement of the small joints of the hands, wrists, and knees. Ligaments, tendons, and the joint capsule may be involved, causing varied deformities. Other musculoskeletal manifestations of SLE include tenosynovitis, rupture of the intrapatellar and Achilles tendons, and avascular necrosis, frequently of the femoral head. Skin manifestations include rash, the signature butterfly rash that affects the nose and the cheeks, hives, libido, fingertip lesions, and hair loss are common. Mucous membrane lesions and some sensitivity could also be involved. Renal involvement is common and a significant cause of morbidity and mortality. Complications include glomerulonephritis, tubular interstitial nephritis, vascular disease. Clinical manifestations of renal involvement include asymptomatic hematuria, proteinuria, frank nephrotic syndrome, and complete loss of renal function. Pulmonary involvement is primary with pleural effusions and or pleuritis. Cardiac disease that is frequent with SLE includes pericarditis, coronary heart disease, hypertension. Also, hematologic disorders may manifest as hemolytic anemia, leukopenia, lymphopenia, or thrombocytopenia. Nervous system involvement can include the central nervous system and the peripheral nervous system. Disorders include headaches, psychosis, mood disorders, seizures, depression, unnatural euphoria, decreased cognitive function, and also confusion. This concludes the pathophysiology and signs and symptoms portion of our presentation.
I'm Siobhan Doyle. I will be discussing the impact of lupus on families and the individuals, how readily accessible the treatment is, how expensive the treatment is, how it affects normal life events such as education, marriage, and children, the support groups that are available, the plan of care for the patient with this disorder, and the top 5 problems that patients with lupus have. The impact of lupus on families and the individual itself. Lupus can affect individuals and families in many different ways. How it affects you would depend on the role that you have in the family. If you're a child with lupus, it can be hard because it seems that people identify you with your disease process and your disease process only. If you're a parent with the disease, it can be hard because you have enough stress dealing with life and children in general. And you have to reduce those stresses, otherwise it causes a flare-up with your symptoms. Parents with your children, you have to also encourage your children to come out and do more and not be so self-loathing with lupus diagnosis, because it's not the end. They can still go on to lead productive lives. They can go on to school and get an education. They can have children, and they can do more things with themselves. As far as the parents go, it's good to have friends and family around you that can take on that parenting role, that can help you relieve some of those stresses that you may have when it comes to dealing with your children. If you are a significant other, it can be difficult when you have a person diagnosed with lupus. Reason because you have a lack of intimacy, a decreased sex drive, or a person feeling less desirable due to changes with their body. It is important to remember that no matter what the relationship role may be, communication is key. One must be able to express when they're feeling fatigued and tired or in pain, so that they know when they need to reach out for help. The roles and responsibilities may need to be rethought or redistributed among other family members in order to get that help. How readily accessible is treatment? Although there is no cure for lupus, specific treatments for lupus will be determined based on your doctor. They determine this by your overall age, health, and medical history, the extent of your condition, and how you tolerate specific medications, procedures, and therapies. Expectations of the course of the disease, how it affects your organs, and your opinion or preference on how you prefer to be treated. If you have symptoms of mild lupus, treatment may not be necessary. It's possible to go with NSAIDs for joint pain. Other treatments include hydroxychloroquine, quinacrine, chloroquine, or a combination of these medications, corticosteroids, immunosuppressive medication, which can also suppress the immune system, monoclonal antibodies such as belimumab and rituximab for selected patients depending on the disease activity as a result of certain blood tests. Patients respond differently to these treatments and are carefully selected by their doctors. Liberal use of sunscreen, decrease the time outdoors between 10 a.m. and 4 p.m. and wear a hat and long sleeves due to photosensitivity. Rest includes at least 8 to 10 hours of sleep a night and naps and breaks during the day. Can you pause it? Okay. Stress reduction, a well-balanced diet, immediate treatment of infection. Children with lupus should not receive immunizations with live viruses, chickenpox, MMR, oral polio vaccine, Consult your child's doctor regarding all vaccines. How expensive is lupus, and will insurance cover it? Treatment for lupus can be very expensive. A person with insurance, they may have co-pays for doctor visits, tests, labs, and prescriptions. Some medications may not be covered by the plan and require copay assistance. Average yearly cost for a person with lupus is $12,600. The IV therapy for a new drug can cost up to $35,000 a year. Those with kidney disease associated with lupus can range from $30,000 to $60,000 a year. Yes, insurance covers lupus. How does it affect your normal life events such as education, marriage, and children? Anyone diagnosed with lupus can still lead a good life by following your doctor's advice, treatments, and living a healthy lifestyle. Lupus patients can go to school, continue education, get married, and have healthy children. But it is recommended that women with lupus trying to have children see a high-risk OBGYN to ensure that pregnancy goes smoothly. Support groups are available for those who are diagnosed with lupus. Tennessee, Alabama, and Kentucky are the Mid-South chapters for lupus support groups. And they have Mid-South is 615-298-2273 is the number to call, or info@lupusmidsouth.org is the website. And there's also one in South Carolina at South Carolina Community Partners, info@lupuscsc.org. As far as the plan of care for a patient with lupus, they have altered renal tissue perfusion related to glomerular malfunction, acute or chronic pain related to inflammation and tissue damage, impaired mobility related to decreased range of motion and pain, movement, risk for body image disturbance related to rash and hair loss, risk for depression related to diagnosis of SLE, fatigue related to decreased activity of pain and depression, risk for decreased nutritional intake due to mouth ulcers, anxiety related to hospitalization and uncertainty about illness, ineffective tissue perfusion, peripheral, related to decreased venous circulation, impaired in skin integrity related to rash on face. We treat these diagnoses as such. When you're dealing with a patient that's having chronic pain, you'll provide them with their anti-inflammatory medications or analgesics as prescribed. Try relaxation techniques or giving hot and cold therapy, use of pillows, turning. Adjust the patient's schedule to help control their pain, and pre-medicate before any therapies. The goal is to improve a patient's comfort level. With fatigue related to decreased activity, pain, depression, you have to plan at least one activity that requires action a day because you want to get them up and moving. Facilitate the development of a schedule between activity and rest. Encourage the patient to stick to their treatment plan. Identify the cause of physical and emotional exhaustion and explain why the need to reduce systemic stress. Encourage adequate nutrition, including iron from food and supplements. Altered renal tissue perfusion related to glomerular malfunction. The patient will demonstrate lifestyle changes that will prevent complication and will participate in recommended treatment plans. So we have to monitor the patient's vital signs, monitor the patient's intake and urine output and daily weights, monitor their mental status changes and report to physician, monitor BUN and creatinine levels and also report to physician, monitor patient for edema in extremities, follow dietary restrictions while yet providing adequate nutrition. For impaired mobility and decreased range of motion due to pain with movement, we want to obtain and gain optimal functional ability. Encourage the patient to verbalize limitations as far as mobility. access the need for physical and occupational therapy, help identify obstacles in the environment and remove them, and encourage independence with the mobility and to help when needed. Risk for body image disturbance related to rash, onto skin and hair loss. The goal is for the patient to state or demonstrate acceptance of change or loss and the ability to adjust to the lifestyle. We want to encourage them to get back out into the community, to get involved outside of the home life, and to be accepting of their appearance. If they begin to demonstrate signs of depression, we want to refer them to counselors in the area to get them help for their symptoms. Thank you.
I will be discussing the effects of SLE, the diagnosis of SLE, prognosis of SLE, tests to determine the diagnosis of SLE, the outcome for some patients that has SLE, and the impact on the patient's daily life, and also the ethics issues. Okay, effects of lupus. It damages to different parts of the body, pain and inflammation to the body. Lupus is also an immune system who can't tell the difference between the foreign invades the body, normal, healthy tissue. It's a chronic autoimmune disease as well. It's also called the great imitator because it does mimic other diseases. Diagnosis of SLE. First of all, when you think about the diagnosis of SLE, they look at current symptoms, they look at lab tests because no single lab test can determine the diagnosis of SLE or lupus, and also they look at immediate family or medical history. Prognosis of SLE. Some patients have normal lifespans with lupus if they follow up with their doctors and visit, and also follow up with the treatments that the doctors recommend. There's no cure for lupus, and some people die from the disease. It depends on the organs that are affected and the intensity of the inflammation. Some people can still live full lives. They can hold a job and bear children. 90% of patients with lupus can live up to 10 years or more after being diagnosed with the disease. 15 to 20% of deaths are usually caused by renal failure, cardiovascular, or infection in some cases. Okay, tests to determine the diagnosis of lupus are ANA, which is an anti-nuclear antibody. They have an anti-SM. There's a protein that's anti-SM. There's a protein that's found in over 30% of people with lupus. They have an anti-DS DNA. It's a protein directed with a double strand of DNA. Usually 75 to 90% of lupus patients have anti-DS DNA, and they're at great risk for lupus nephritis. CRP, which is a C-reactive protein that indicates an inflammation in the body. ERS, it also indicates the inflammation by the speed of the red blood cells. CBC, which indicates a normal blood cell count, for instance, decrease of white blood cells, indicating leukopenia. Also, they use the CBC to look at their platelets, including thrombocytopenia, which is a decrease in platelets. A chemistry count is also done. It's electrolytes, blood sugar, cholesterol, triglycerides, and triglyceride levels. What's the typical outcome for people with lupus? Depending on the affected organ or organs, that will determine the outcome. If the symptoms are managed well with medication, the outcome could be good. Long-term care is provided because lupus is a chronic, non-curable disease. Patients can experience remission. If the patient is diagnosed early and receives the appropriate treatment, he or she can live an active life. How does lupus impact the patient's daily life in terms of ability to carry out normal ADL? Most times patients they're fatigued, which is tired, have pain or inflammation, they have joint pain, and 1 in 5 are disabled because of the fatigue, muscle, and joint pain. Ethical issues pertinent to lupus. One of the ethical issues is pregnancy, maternal and fetal complications. Most times it causes spontaneous miscarriages. Job. Some are unable to perform their job work duties because of being tired and pain to the joints and muscles. Challenges in treatment development, because to determine who do they choose to research. Psychosocial problems is adjusting to the disease, and they have limitations because they require a lot of counseling throughout this process because it is a chronic disease.